Hi, I'm Dr. Saguil. The tutorial today is on gastroesophageal reflux, also known as GERD. This is a very common symptom and a very frequently diagnosed disease. The ICD-9 code that we use in the office is one of the most popular. But I wanted to show you an illustration of what usually happens. If you understand the mechanics, you'll understand how to help yourself heal up from this instead of just rely on certain medicines. So, gastroesophageal reflux. This is what happens when you're supposed to eat normally. You chew your food, hopefully macerate it so the amylase from the saliva starts to break down some of your carbohydrates. Once the food gets into a small enough bolus that we're comfortable with, the bolus of food, or the round molecule or round pebble of food, comes down through the esophagus. The esophagus is just a transport tube. It works like a snake, so it contracts, pushes the bolus of food down. The next section contracts, it keeps on contracting until it gets right below the diaphragm, and then it drops into the stomach. The diaphragm is right about here, underneath our ribs. On this illustration it's here. The esophagus pierces the diaphragm, and it's only that small hole that pierces that very strong muscle, the diaphragm. And you'll notice that in this area where it pierces the diaphragm, you have a concentric band of muscle called the lower esophageal sphincter, a group of muscles that's supposed to choke off the hole. If it does that properly, then the food bolus that came from up here mixes in with this bath of acid, and it starts to digest. The stomach starts to churn, contract, expand. The acid and the food mix together. Eventually it breaks down, turns into chyme, and that's kind of the same thing as vomit. Turns into that, and we have to have vomit of that consistency because it gets absorbed through the small intestine, which is the next step. It doesn't get released into the small intestine because there's a pyloric sphincter here. So the two sphincters close off, it shakes up, mixes the food and the acid. When it's ready, sends it on through. Then the next bolus keeps on coming down. The problem with gastroesophageal reflux is when this lower esophageal sphincter is not working properly, the bolus that comes down goes through, comes into the stomach, and as the stomach churns, the acid splashes back up. If the acid splashes back up, it hits this lining, the lower esophageal lining. And the lining of the esophagus is unprotected. It doesn't have any thick mucus. The lining of the stomach has a lot of thick mucus just dripping off of it because it's a pouch that holds acid and has to protect itself from the same acid it holds. So if it didn't have that mucus lining and all just acid, you would get this. This is the stomach, this is an ulcer. It's essentially a scab on the inside. Like if you skin your knee, on your knee you have a scab, it forms, it goes away, falls off in about 10 days. Same thing with the stomach, but this thing constantly shows, or gets exposed to acid, so it never heals up. So you don't want that, but it sometimes happens if you don't have enough mucous membrane lining or thick mucus. I always think of that movie Aliens, the big alien monster which had a high pH. If you watch the movie, you'll remember if the blood of the monster splashed on anything, it would burn, even through metal. And to neutralize that, it was covered in mucus, the sticky stuff. Well, same thing with the lining of the stomach. I think the director thought of it when he learned about his anatomy. But anyway, the problem is the stomach is built for its own acid. The esophagus is not built for the acid. So if this acid splashes back up this way, it starts to irritate the esophagus. Remember, if that esophagus is supposed to keep the acid up and you splash a little bit into the esophageal sphincter, it irritates it and it opens the sphincter up even more, and then more acid splashes up. So what's the problem with that? Well, talk to anybody with reflux. What happens when they tie their shoes? All the food comes back up and they essentially vomit. Not a good thing. You can actually choke on that, you can cough up, you can get pneumonia from that. And more than that, when this lining is, this is a picture of the lining of the esophagus, when you burn it and heal it, burn it and heal it, burn it and heal it from constant acid, it'll repair itself, but after a while, the fast changing cells will become precancerous. That's called a Barretts Esophagus. A precancer will always lead into a cancer if you don't do anything about it. Usually it's because of that. The only way to find it is scoping. So if I have anybody that has persistent problems with reflux, I'll send them to a GI specialist. GI specialist will actually take a scope, put it down the throat, look into the esophagus, look at the lining, look into the stomach, and take pieces or biopsies of tissue, just tear them off. Send that for biopsy and hopefully find that it's normal, but occasionally find the Barretts Esophagus or the precancer. There are ways to take care of that, and the ways to take care of that Barretts Esophagus, you stop the acid from being produced. If there's no acid in the stomach, like by using prevacid, that's who made this poster. If there's no acid in the stomach, theoretically you'll heal up. In this ulcer that's forming here, if you take away the irritating focus, meaning the acid, and you line it with mucus again, it'll heal up. We can take away the acid, we can stop it cold. No more for acid production when you use prevacid, but you can't really throw mucus in there. Sometimes we can take something called caraphate that sometimes lines the crater, but the most important thing of this is to eat properly, get a proper healing anti-inflammatory diet, and then there are some botanicals that also help heal up, and hopefully the body, if it's healthy enough, will heal itself. The problem is, most of the time, in your average clinic, when people come in with reflux symptoms, we hear that they're smoking, we hear that they're taking anti-inflammatories like Advil, ibuprofen, Motrin, Aleve, naproxen, aspirin, and then we'll put them on prevacid. Oh, the other thing is drinking too much coffee, also drinking a lot of alcohol. And the last thing is stress. A bunch of stress will always increase the amount of acid, screw up digestion, give you ulcers. So all that stuff that I just mentioned, I'll list them all on the side, can be battled with the medicines I'll list on the other side. Prevacid, priosec, Nexium, Protonix, all of them are great. They take away all acid. They're fantastic. They're better than the old-fashioned medicines. Tagamet, zantac, and pepcid, those are H2 blockers from the 70s, 80s, and 90s. They worked great before. I probably shouldn't say 70s, 80s, and 90s. There's probably more towards the 80s and 90s. But they worked great before when they were prescription. People got better, but somebody found this new stuff, proton pump inhibitors, and made a killing off of it. And now we're making this one of the most prescribed medicines. If you look at your formularies, every time we write a prescription for this, there's always a callback from pharmacy saying, hey, it's not on formulary, it needs a pre-authorization. That means I have to get on the phone, I have to go talk to some other doctor or from the pharmacy or from the company and say, or the insurance company, and say, hey, can I have this medicine? And then they'll ask me a whole bunch of questions, and I'll have to have, yeah, the patient failed it, he has this problem, he has got a Barrett's, it's terrible. And they'll approve it. So that's a whole, that takes 20 minutes to 40 minutes. If I'm seeing patients every 15, that's in a standard clinic like I used to do, who has the time for staying on the phone for half an hour to 40 minutes? But anyway, that's what the insurance companies will tell you. You have to get it pre-approved. Otherwise, you have to go see a specialist. And that's, again, that's what the specialist does. But let's get back to the pathology here. Stomach is built for acid if it has mucus. If the stomach's not producing mucus, like in stress, smoking, tobacco use, alcohol use, anti-inflammatory use, or if you just have a history in the family of ulcers, then you're going to have a thin layer. And this happens when you get older too, a thin layer of mucus. No protection, same old acid, you'll burn a hole in. So the idea is, if you do have, we'll just do this for people who do have reflux. If you do have reflux and you're stuck on prevacid because you can't get off of it, and you have made the changes in diet, I'll talk about that in a second, then hopefully this changes on its own. But the majority of people that are on all these proton pump inhibitors usually cannot get off of them. There's a nice study in Europe where they took people who had reflux symptoms, they scoped them all, they found a small percentage who didn't have any biopsy findings at all, and they took them off of the 4 weeks of the proton pump inhibitor that they were on. Remember, these are people that were scoped and found to not have any findings on scope, just symptoms of reflux. Well, they put them on the reflux medicine, They said, oh, you don't have any disease, your scope, let's take you off. After 4 weeks, they took them off, and they found that the patients got even worse after they took them off. So there's a quality of these medicines that's somewhat addictive. The stomach probably gets very used to having the medicine stop its acid. So if you're on it for a while, it might feel great, you might get rid of all your symptoms, but once you take yourself off the medicine, the stomach will really viciously make a lot of acid. That's my theory. Make a lot of acid, give you all the symptoms. Remember, those folks who did not have any findings on scope were attempted to be pulled off the medicine that they were on for a protocol, and they had all the symptoms of reflux, even worse when they tried to get off their medicine. So you can kind of put 2 and 2 together and figure it out on your own. Otherwise, my suggestion is, if you have reflux, certainly get some pain relief with using those medicines, the protonics, prevacid, priosec, Axib, all those medicines, Nexiums, to decrease the acid temporarily. Also, change around your diet. If you have an irritation to the stomach when you eat acid foods, orange juice or juices in the morning, tomato juice, chocolate, peppermint, alcohol, coffee, caffeine, coffee bean, even if it's decaf. Stop it for a short time. Deal with all the symptoms of withdrawal. Stop it and let your stomach heal up. Stay on the medicines for a short amount of time, but also have a plan to get off the medicines. I will usually use botanicals like DGL, slippery elm, marshmallow root to help heal up. Peppermint, if done in terracotta, will help move the stomach contents fast so that they don't irritate too much. Ginger is a prokinetic. It helps move things. So there are certain medicines, botanicals, that help to heal or facilitate healing. The body should be able to heal. If the body is having trouble healing, find out what the problem is, help or encourage the body to heal with an anti-inflammatory diet, modify the diet if it's irritating, maybe use botanicals to help heal up even faster, and also use prescription medicines to help with some of the symptoms while you're waiting to heal, but always have a plan. The problem with some docs is that, some of my colleagues, is that all we do is prescribe this, it works great, see the emergency room, give you this, 3 or 4 weeks, fine. And then we'll have constant refills over the course of 12 months. Wow, this person is using it all the time. Just give her 3 months, and before you know it, you're on it for life. If you look at the black box warning in the PDR, Physician's Desk Reference, you're supposed to reevaluate after 12 weeks. You're not supposed to use it past 12 weeks. The problem when you shut down acid is you do feel great, but remember, acid is there to digest. If you have no acid digesting, what's doing the digesting? You're not digesting, and you're usually passing this protein right on through. You all who like to eat big pieces of steak, well, that steak, when you're on prevacid, it doesn't do anything. It just, you hopefully will have teeth to chew that steak. That's all you're going to have. By the time it gets down here into the esophagus, into the small intestine or colon, it's still pretty solid form, maybe a little mushy, but it causes irritation, makes it poop right out. And usually people are on prevacid for a long amount of time, they don't digest protein well, and they're usually low on their B12 levels, because that's what you find in the meat that you're eating. And I'm not saying avoid, this is different, it's not avoiding meat, this is about the concept of what to do when you're on a medicine. If you're on a medicine, curtail the diet. If you're just on a diet to manifest or heal, great. Keep on going, get some help. But the ultimate problem, again, with reflux is that you have a little irritation to this area. It might even have an ulcer like I indicated on the illustration. Either way, the signs and symptoms are telling you you have to change your diet and fix the healing process. So do what we talked about. Have a doctor see you. Don't just rely on over-the-counter medicines. And by all means, look up the diet for reflux. Stick to it. Fix any deficiencies that you might be having because of the altered diet. And then also take care of stress. I think it's a big thing that my patients kind of forget to take care of. Stress is definitely a cause of ulcers. In addition, stress causes you a whole bunch of other things, but this is definitely manifest. So hopefully this gives you a little bird's eye view. Again, a couple of things as far as prescription medicines to try, a couple of things as far as herbs to try, but definitely a whole bunch of things as far as stress reduction and diet to really be on, because your body's telling you it needs to change.